Hi, Dr. Ramsey Choucair, a board-certified plastic surgeon here in Dallas, Texas, bringing you another educational video about our practice. Today we're going to talk about what you might expect if you came to have a facelift. Hopefully before surgery you're well aware of most all the details of the surgery, as I've talked to you and the nurses have prepared you and the anesthesiologists have talked to you. But the morning of surgery you arrive hopefully having had nothing to eat or drink, which most people know is pretty standard. And then we visit with you and get you prepared for surgery by me speaking with you again and going over the surgery and making some marks on your face with the mirror in your hand so you can see what we're doing. The anesthesiologist visits with you and answers your questions and starts your IV. And then after we've had you somewhat hydrated with IV fluid, we walk you to the operating room, which is here in our office. 90% of our facelifts are done in our office. We have a completely certified operating room, and so the anesthesiologist is starting to give you medication, but prior to that, myself and the nurses are visiting with you and trying to make sure that you are comfortable. The next thing you know, you're waking up and you're in our recovery room across from our operating room in our office, and our nurses are taking care of you and making sure your vital signs are stable, giving you something to drink and answering questions that you probably won't remember we answered until the next day. So we usually answer them again, because usually in recovery, even though you're awake, you don't remember everything. And then after that, we walk you down the hall to our nice overnight room, our convenience overnight room, because you're certainly able to go home, but we feel like in most cases of our facelifts, the patient and the family are happier when we can take care of you here. So we have a private nurse who comes in and takes care of you that evening, makes sure you're well hydrated, make sure your medications are taken care of, make sure you're up walking around, and hopefully sleep comfortably. The next morning I come in and see you along with the nurses. We take the dressing down, we give you the mirror so you can see what we did to you. If you have any drain tubes, which is not uncommon with our facelifts, we remove those, and then hopefully we prepare to send you home with your loved one to take care of you until we see you for your suture removal. Everybody has my cell phone number. If you have any questions, we're available. And that's kind of the story of coming in for a facelift.